Welcome to today's discussion on atrial myxoma, a rare but significant heart condition. In this video, we'll explore the various aspects of this disease, from its origins and impact on the heart to diagnosis, treatment, and what the future holds for those affected. Let's dive in and learn more about atrial myxoma. The exact cause of atrial myxoma remains largely unknown in most cases. The vast majority occur sporadically, meaning they arise without a clear genetic link. However, a small percentage, about 7–10%, are associated with inherited genetic mutations, particularly in Carney complex. Carney complex is a rare genetic disorder that can cause various tumors, including myxomas, skin abnormalities, and endocrine problems. Research continues to investigate potential contributing factors and genetic predispositions. Atrial myxoma is essentially a benign, non-cancerous tumor that grows within the heart's atrium, most commonly the left atrium. As it grows, the myxoma can obstruct blood flow, especially through the mitral valve that separates the left atrium and left ventricle. This obstruction can lead to a variety of cardiovascular problems. The tumor's surface is often fragile and can shed small fragments, known as emboli, into the bloodstream. These emboli can then travel to other parts of the body, potentially causing strokes or other complications. The presence of the tumor can also trigger an inflammatory response, further contributing to symptoms. Atrial myxomas are rare. Their incidence is estimated to be between 0.5 and 1.0 cases per million people per year. They are more common in women than in men, and can occur at any age, but are most frequently diagnosed between the ages of 30 and 60. Familial myxomas, associated with Carney complex, tend to appear at a younger age than sporadic cases. The signs and symptoms of atrial myxoma can vary widely depending on the size and location of the tumor, as well as the degree of obstruction it causes. Many patients experience symptoms similar to those of mitral valve stenosis, including shortness of breath, particularly with exertion or when lying down, fatigue, and lightheadedness or fainting. Some may develop palpitations, chest pain, or a cough. Because emboli can break off from the tumor, some patients might present with stroke-like symptoms, such as weakness or numbness on one side of the body, speech difficulties, or vision changes. Additionally, some patients experience systemic symptoms, such as fever, weight loss, and joint pain, mimicking an inflammatory condition. These symptoms can make diagnosis challenging. Diagnosing atrial myxoma typically involves a combination of physical examination and diagnostic imaging. A doctor may hear a characteristic heart murmur during auscultation, which raises suspicion for the presence of a cardiac mass. However, echocardiography, specifically transthoracic or transesophageal echocardiography, is the primary diagnostic tool. This imaging technique uses sound waves to create a detailed picture of the heart structure and function, allowing visualization of the tumor. In some cases, further imaging, such as cardiac MRI or CT scans, may be necessary to better define the tumor's size, location, and characteristics, as well as to rule out other potential causes of the patient's symptoms. While there are no specific classifications based on subtypes of atrial myxoma, we do differentiate between sporadic cases and those associated with Carney complex. Tumors associated with Carney complex may be multiple, occur in different locations within the heart, and are often diagnosed at a younger age. Sporadic myxoma is typically present as single tumors in the left atrium. The primary treatment for atrial myxoma is surgical removal. Surgical excision offers the best chance for a complete cure and symptom relief. The procedure is usually performed via open heart surgery, where the tumor is carefully removed, along with a small margin of surrounding healthy tissue to ensure complete resection. In some cases, reconstruction of the mitral valve may be necessary if the tumor has caused significant damage. After surgery, regular follow-up appointments with echocardiography are essential to monitor for recurrence. For patients with Carney complex, genetic counseling and screening for other manifestations of the disease are also recommended. Since most atrial myxomas occur sporadically and their cause is unknown, primary prevention is not currently possible. However, for individuals with Carney complex or a family history of atrial myxoma, genetic screening and regular cardiac monitoring can help detect tumors early. Early detection can allow for timely intervention and improved outcomes. The prognosis for patients with atrial myxoma is generally excellent following surgical removal. The recurrence rate is low, typically less than 5%, especially with complete surgical excision and close monitoring. However, patients with Carney complex have a higher risk of recurrence, highlighting the importance of lifelong surveillance. Recent research focuses on understanding the genetic basis of myxomas, particularly in Carney complex, and developing targeted therapies to prevent tumor growth or recurrence. Additionally, advancements in minimally invasive surgical techniques are being explored to potentially reduce recovery time and improve patient outcomes.